Welcome to Between the Sheets, the podcast where we're going to cover a variety of topics related to sexual health and wellness. I'm Dr. Stephanie Zwonitzer, your host. I'm a nurse practitioner and have been in practice since 2017. I have my Doctor of Nursing Practice degree, and I specialize in urology and sexual health. I am so excited to explore all of the various topics related to sexual health and wellness with you in a fun, spicy, educational, and non-judgmental manner. So come on, let's get between the sheets. Hey everybody, welcome back to Between the Sheets. I have an awesome guest on today. I have the pleasure of introducing my friend and colleague Ken Mitchell today. Ken is a physician assistant. He's pretty much the best PA ever. He's been in men's health for nearly 3 decades. And in 2023, Ken was named the APP of the Year by the American Urological Association. Ken and I both went through the University of Nebraska for education, him for his PA and myself for my BSN. We were just a few years apart in
Just
there,
a few.
but just a few. Ken has many publications, speaking engagements, and he even co-founded and is CEO of GUYnecology Men's Health, which is a nonprofit organization dedicated to men's health research, provider training, consumer education, and health promotion. And that's where I met Ken. I went to his gynecology conference a few years ago and have been blessed to keep him in my network and as a friend ever since. So welcome, Ken.
Thank you for having me. My pleasure.
Yeah, absolutely. So we're going to dive into a very popular topic here, some premature ejaculation for our men, and kind of go through how we work it up, what we do for these guys. And so Ken's going to help us talk through that.
All right. Sounds great. Gosh, I don't even know where to begin. Maybe a little bit of background, but even, it's sort of the one that's kind of gets left behind, no pun intended. A lot of guys just don't talk about it. So they suffer in silence for a long time with it usually. We divide that up into, lifelong, versus acquired premature ejaculation. At the end of the day, it seems that most men, for a number of reasons, mostly social reasons, just don't want to talk about it. And you add that to the list of things men don't want to talk about. This one's pretty far. It's pretty up there. Things that just don't even want to address. Even if they come to one of us, it is still that one that's just, I'm not sure I'm ready for that one yet.
Yeah, they'll tell me about their ED way before they tell me about their premature ejaculation.
Right. Yeah. And even as a provider, it's kind of tough to tease it out. The history is very difficult to get sometimes. Circumstances and things, relationship changes, things like that. I mean, that can all play a role in it, as you know. And so, we try to pay close attention, and, we don't have a lot of validated questionnaires. So some of it takes trial and error and time and experience for you to really get a good rapport and to get a good history and take care of these guys.
Yeah, for sure. So when they come into you and you're their provider, and they're saying, man, I just ejaculate so quickly, my partner's not happy. What are kind of some of the things that you start to ask them to try and figure out exactly what's going on?
Right. So most of it, again, ask them how long they've been in the relationship. When did this start? Because again, we're going back to that lifelong versus acquired. I will ask them about their erectile function, of course, things like that. Essentially, you can't leave no stone unturned. So you really have to treat them like a low T ED patient. Make sure that you don't have any other contributing factors there. Are they diabetic? Have they had, are there any mental health issues? Has there been any history of abuse? Things like that have gone on that you want to pay attention to, and not be uncomfortable about asking about any types of sexual encounters that they've had historically. Have they had good, healthy sexual relationships in the past? Again, once you've kind of teased all that out, then you can really start honing in. Not to beat a dead horse, I had a tremendous mentor in this area, actually. There's a guy named Michael Metz, actually. Those people that have been around sexual medicine know of him. He, oddly enough, was in my backyard for at least 3 years before I realized he was down the street from me. After I'd been reading his work for years. When I was in Minnesota. And he wrote what I believe some of the best books ever written from a sex therapist perspective. And he wrote these books. They're all coping with erectile dysfunction. And the one he wrote was coping with premature ejaculation. And I remember when he wrote that, after we met for the first time face to face, we had this regular once a month. We met for coffee.
Love it.
And he gave me a copy of that book. And that's sort of been my Bible, if you will, for, evaluating and managing these patients in a very thoughtful and thorough and respective way.
Yeah.
And he unfortunately passed away several years back. But if you'd ever met Mike Metz and then you read one of his books, it's impossible not to have his voice in your ear. He was very disarming and calming,
Yeah.
just as a rule. So, I'm not the only one who's gonna have a dog to
Yeah,
stop and
Milo
visit.
pokes up sometimes.
I love that. I love
Yeah.
that. I'm sure before this is over, this will happen to me. So yeah, I mean, so I've always kind of taken that kind of approach, follow kind of his mantra. Of course, over the
Mhm.
years, we, you mentioned how long I've been doing this. We didn't have a lot of options for treatment back in the day.
Yeah. Yeah.
We have more, but compared to other disease states that we treat, nowhere near the armamentarium, if you will.
Yeah. One of the things I like to tease out from the guys too is whether it's happening just with intercourse or if it's also happening with masturbation. Because, there's some guys where it's with both and there's some guys where it's one or the other. So that I always like to pull out as well.
Yeah, I mean, and that's again just kind of that whole relationship thing. You hate to say it, but guys have multiple partners. Sometimes it happens with one partner, not
Hmm.
another.
Yeah.
And again, those are the things you need to tease out. Is this really premature ejaculation?
Hmm.
I think the best story of a patient that I had that I could share is a guy who was married for a long time to a woman, and unfortunately, they split up. But he had said, the sexual script that he gave me was that they had sex in the middle of the day, not for very long. That
Hmm.
was good for them.
Hmm.
And then he got into another relationship and he got remarried, and this his new wife wanted to have sex longer. Apparently he was able to do that, but he felt that it wasn't long enough for her at times. And then when I asked the question, after getting all this information, I said, so tell me, how long are you able to successfully engage in intercourse? He said, well, about an hour. And he said, and I go, well, um that is not premature.
Not even close.
Yeah, and I
Yeah.
said, in fact, I said, now you're bragging. I'm like,
Right.
no.
Right.
But it was just the difference from one relationship to another led him to believe that I'm not lasting long enough, so clearly I have an issue. And
Right. Yeah.
and thankfully I had Mike down the street. I said, you need to go see this guy
Right. Right.
and your partner. You all both need to go down there
Yeah,
and talk
yeah,
about
it's a group
this.
effort. Yeah. Well, and I love sending my patients to sex therapists because they do get that extra time to kind of talk through those things. And there is a huge mental component to this.
Absolutely. As you know, we have a number of medications we use off label, like SSRIs and
Hmm.
the like, and those are very useful. But a lot of times they have more of a, they take a while to help.
Hmm.
And these folks are, interestingly enough, are certainly eager and anxious when they finally have enough courage to come see you. They do want something to help them fairly quickly.
Yeah.
That's the irony of it all, right? I mean, that they've
Right.
usually had this for a long time, but they want it
Yeah.
fixed right away. And,
Yeah.
but, I tell guys all the time when they say, is it psychological? And I say, absolutely. Even if it's only been 6 months, it has had a psychological impact.
Yeah.
And in fact, if you look at the physiology, I mean, it would tell you that, particularly in the acquired type, that's definitely going to be something triggered it,
Right. Right.
and that's what you
So
got to
the
figure out.
Yeah, the traditional, diagnosis that we go by is the less than a minute from penetration to climax. But I have guys that they can last 3 to 5 minutes, but that's not good enough for them. They want to be longer than that, which I think is reasonable. The guy that you were explaining an hour, that we're good there. We don't
Right.
need to extend you. But the 3 to 5 minute guys, I mean, they're not technically premature according to the traditional diagnosis, but they want to satisfy their partner. They want more intimacy. So what are you kind of talking to those guys about? Are you treating them? Are you just kind of sending them to therapy? How's your approach with them?
Sure. So you definitely want to treat those guys. We're kind of back even like, ED, that word satisfactory, right, has to
Hmm.
be taken into account. And it's not by my standards, by theirs.
Right.
So you ask the questions, and you say, look, if it's more of some things you need to learn technique wise, or
Hmm.
there's some things that we can do with we have topical things, we can still use SSRIs in those patients at low dose. The idea for them really is to help them, one, get control,
Hmm.
which is generally their biggest issue, is they don't have control. And of course, we start talking about everything from once the thought process kicks in. oh my gosh, am I going to last long enough?
Mm-hmm.
No,
Yeah.
you know, party's over, right? I mean,
Right.
so
Right.
so that's a lot of it. And I've even explained to the patients a lot of times when I tell them, I sort of break it down very simply. I said topicals are your short-term answer. Things like SSRIs, things like cognitive therapy, all of those things are your long-term solutions. And the hope is that the long-term solution will be the one that is in fact the helpful one. The short term won't be required any longer. You can
Mm-hmm.
transition and hopefully you don't need any of it. Hopefully you've learned enough and you've taught your body. And I'll tell you the validated quote that I used to give in talks, oddly enough, was from a porn star, Marilyn Chambers. I know she wasn't talking about premature ejaculation, but I thought it was great words to use. But she said, "Good lovers are made, not born."
Very good advice.
And I said, "Oh, well, that's a great way of looking at it because, you do have to sort of train yourself for your partner. We talk about
Mm-hmm.
sexual scripts. It's something that it's an agreed upon mutual. This is how we do things, and that's what works for them."
Yeah. No, that's awesome. It's very good. So for our listeners that aren't medical like we are, so you talk about the topicals. So for like I recommend Promescent. It's a spray that's in the condom aisle. What else are you recommending?
Yeah, Promessa's kind of been my go-to for a long
Yeah.
time. I was fortunate enough to be one of the first users of it. I happened to stumble upon Dr. Gilbert through a mutual friend actually, and he was telling me about it, and it was again just the way it was formulated. I said, well, that's different. I said we should
Yeah.
try that, and I sort of did an unpublished sort of trial in my office where kind of like what I was just mentioning, where we gave them topical for a period of time,
Hmm.
followed that with, and then immediately thereafter, once they got a little bit of a response, then we added the SSRIs, and then
Okay.
followed them. Very small number of patients. We followed them out for quite some period of time.
Hmm.
And then what we discovered was that once they were you now start using the techniques, a lot of times
Hmm.
again stuff that I got from Mike Metz, that seemed to make a huge difference in our guys. And then we were able to sort of get them to feel what was happening, help them get control, and then we were able to start
Yeah.
taking the treatment back. And it was great, and open up dialogue with them and their partners too, which they
Hmm.
hadn't had before. We think, I think that has a tremendous impact all around, for
Yeah.
having better these sexual relationships.
Yeah, absolutely. And for people who don't know, Promescent is basically like a numbing spray and kind of numbs the guy up so he can have less sensation. So hopefully he doesn't orgasm as quickly. But you do need to make sure that it dries on and soaks in before you penetrate because your partner doesn't want to be numb.
No, and there's something a little bit unique about that one is it has I used to draw these little pictures. I said the typical topical lidocaine. The molecule is suspended in the gel, doesn't really get to the skin surfaces to help numb the nerve endings. This was sort of a mixture where it did really get to the skin surface, and again, a little bit less transfer. But you're right. I say, it's a little until it's not.
Yeah. Yeah. Yeah.
Everything's fair game. But you're absolutely right. But again, it's just not a long-term solution, and if again, as long as I've been doing this, when it was all we had, I mean, it was like, this doesn't work, nothing will work.
Yeah. Yeah. So the SSRIs, that's my go-to as well as far as prescriptions. So those are antidepressants for people who
Hmm.
don't know what an SSRI is, serotonin reuptakes. And so I usually start with Paxil. That's kind of my go-to. Is that where you're at too?
Yeah, I mean, if you look at the studies of all the SSRIs, that one had the greatest delay at the lowest
Hmm.
dose.
Yeah.
So it was easy. Before I did, urology space, I did general internal medicine. And I did a lot so I had a fairly good handle on how SSRIs worked, which ones
Hmm.
might be better.
Yeah.
It's interesting when I'd get patients referred to me that were put on ones that were great antidepressants, but they were terrible because they had very low side effect profile.
Yeah.
And they're like, well, I tried one of these and it didn't help. And I said, which one did you try? And they tell me, I go, oh, well, that one's really not going to do that for you.
Right.
So,
Right.
but yeah, and you got to believe too, for that patient, obviously all of them are going to have some anxiety level that if you can teeter up to that edge where that'll take the edge off the anxiety in addition to get the delayed, ejaculation and orgasm, that's worth it. It's win-win, I should say.
Yeah. Yeah. So you said taking to the edge, which makes me think of edging. So a
Mhm.
lot of guys will practice this to try and get themselves some more control. Have you found that to be effective for your patients?
Yeah, we get a little of that, guys will try that. There's also the pre-intercourse, ejaculation.
Yep.
So, so that they can, hey, I've got, I can get an erection, but, they'll have a prolonged latency time for their next
Mhm.
orgasm. So they like that. All are in the list, if you will, of techniques one can do. The start stop, is another one I think is really important. I do like that one if it's done appropriately, and that is
Mhm.
if you start educating the guy and his partner about when you start feeling overly aroused, about how to just calm yourself.
Mhm.
And that's the I think the most difficult thing to do, especially when that's been the response for so many years.
Mhm.
To suddenly change that is really hard to do that. And, as you mentioned, we have to be mindful of that from a mental health
Yeah.
standpoint.
Yeah.
That's going to make a huge impact.
Yeah. I've had some guys try the squeeze technique where they'll either squeeze their testicles, they'll squeeze the head of their penis. I haven't had a lot of guys have success with that.
No,
Okay.
I'm sure there are much more comfortable distractions when engage. Besides that, yeah, it's funny. I don't think I've ever really told anybody to do that. To be honest with you,
Yeah.
I mean, I know it's out there. I guess because I haven't is why I didn't even mention it.
Yeah.
And I come to think of it, when you said that, it's doing it to yourself or having your partner do it to you. Like, frankly,
Yeah.
to me, it sounds like a real mood killer. But so,
Yeah. I think so too. Do you think so too?
yep, I like that. Glad we got an audience. This is good.
Yes, he likes to learn. Sometimes he contributes little noises as well, but tonight he's seeming to be quiet.
Well, mine ran by, so I didn't know if you
Okay.
heard that or not. But
No.
no, okay. So he
Yeah.
did. They're about the same size, I can tell looking at them. So yeah.
Yep. Yeah. It's good. Dogs are the greatest. So, okay, so we kind of talked through, some of the techniques, the SSRIs. Is there a time where you would wean one of your guys off the SSRI once they get to that control level, or is that going to kind of be they're going to be on it?
Yeah, I do. I generally, again, realizing that if somebody's been dealing with this for a long time, I think of more not even having that discussion, if you will, until about 6 months after we've been doing consistent therapy.
Yeah.
And then, I'll start asking questions. And again, none of these are validated questionnaires. I mean, there's some that are out there. I'm just going, there's the PEDT, I think is one questionnaire a lot of times people use. But a lot of times, again, the analogy that I give them, I said, this is like something that's erupting inside of you, and if you can slow it down, if you can see it now before it happens and get in front of it, then that's when we can start talking about what did you do then when you did that. I don't talk about that beforehand, so I will start looking for this. I want them to focus more on wins. Like, okay, do this, get a win, feel like, okay, I now I feel comfortable, like I'm capable of getting better. Anything is, any progress is good progress here. And once they've done that, and again, they start kicking in some of their own repetitive coping skills, then I can,
Hmm.
start, okay, let's quantify that. We
Yeah.
talk about how you can repeat that over and over again.
Yeah. I mean, I think the biggest takeaway for the guys that are dealing with this is that there is help and we can help you get longer lasting, and it doesn't have to be something that ends your relationships.
Right. What, if you want, I can share with you one of the things I'm thinking. So I'm in a practice here in Nashville, and I've talked about this for a long time and getting close to pulling the trigger on this. I've thought of all the things that I've seen on a telemedicine platform that was uniquely suited to this disease state was
Yeah.
premature ejaculation. And, at the end of the day, this is something that takes a lot for a guy to come in.
Hmm.
Even if your initial consultation can be done in this, in a telemedicine platform, it's much more engaging, and you're
Hmm.
and you're more likely, if you can have one good initial encounter with anything we treat, you're more
Yeah.
likely to have a good outcome.
Right.
And this one's so delicate, just in terms of the patient's ability to be forthright.
Yeah.
Really good. So we're launching a platform after the first of the year where this is what we'll be doing.
That's awesome.
We'll do this telemedicine platform. We'll deploy some questionnaires. I'm going to go with that just because I think it's helpful to have something that you quantify.
Yeah. Yep.
Most of the medications, including Promestin, are available over the counter now, and you can get pretty much any pharmacy. I'm a big believer. If I get a patient who's willing to read, I still tell people get on Amazon and get Coping with Premature
Yeah.
Ejaculation by Mike Metz.
Yep.
I'll say start reading, educate yourself. This can be done pretty easily. If I start talking about bringing in a patient on the SSRIs and stuff like that, probably, I can tell you what in my head, not probably, in my head, what I've said was initial consultation, telemedicine, one visit live. Could
Mm-hmm.
probably do the remainder telemedicine after that. But
Yeah.
you'd have to lay eyes and hands on them, for sure, making sure you don't get any body language or anything suggestive of somebody
Yeah.
having depression, anxiety, anything like that, knowing that
Yeah.
there is a risk if you're prescribing an SSRI
Yeah.
of compounding things. So that's really what we're hoping to do. And, I think there's a huge cost savings for sure when you start using these types of platforms, using them more efficiently. And I know I said before the call that I would not talk about workforce, but we got a diminishing workforce. We have to be very
Yeah.
creative in how we're going to deliver
Absolutely.
this care.
Yeah. And I think you're right too, just because of the delicacy of the matter. Like it takes a little bit of it away being over the computer that I'm kind of a stranger, but you may or may never have to see me again if you don't want to. So
Right,
it's kind
right.
of more comfortable over the computer, I think. So I think that's a great way to do it.
Yeah. So stay tuned. Hopefully, we can
Yeah.
circle back sometime. Be happy to share with you how it's going. So I hope
Yeah, that'd be
it
awesome.
goes well. So, but it's a problem. Guys are looking for it. I
Yeah.
shared with you. Like I said, we did a market search on it, and it was the number 3 Google search on guys.
Wow.
It was this premature ejaculation.
Yeah.
I was shocked. I was ready to, make a pitch for, hey, let's go after number 10. Yay.
Right. Right. Yeah. Yeah. Well, I'm sure it's a big issue. I will have patients come in and thinking they have an erection issue, and it's
Hmm.
actually premature ejaculation. So they'll come in and they'll tell me all about their erections. And as I'm teasing through these questions, their erection is perfectly fine. It's just that they're
Yeah.
orgasming too quickly and they think they're losing their erection, but it's just because naturally your erection goes down after you climax.
Yeah. And that's tough. Like I said, if it's nowadays you could argue the logic is not flawed. Everything is an erectile function, if you will. I mean, it's
Right.
related. It's somehow related to it, right? So
Yeah. Yeah.
but or erectile dysfunction, excuse me. But
Hmm.
so I Peyronie's disease. All of them. People say that. I go,
Yeah.
you're right. It is, but let's just get a little, dig a little deeper on what that
Right.
means for you. So,
Right. Yeah.
um,
Yeah. No, that's awesome. All right. So we've kind of like helped the guys who orgasm too quickly,
all
the
right.
premature ejaculation. So switching to the other side, guys
Yeah.
who last an hour, like your previous patient you were talking about, or longer, or just really have a difficult time getting the orgasm itself. They can stay hard, they can have sex as long as they want, but getting that orgasm is really difficult. What are we doing for them?
Yeah, right. So complex problem.
Mm-hmm.
Typically, happens in our older guys,
Yep.
usually, right? Or
Yep.
those that have undergone procedure, they have some type of comorbidity, whether neuropathy is a byproduct or a side of,
Yep.
or symptom of some existing illness they have. So most of us trying to figure all that out, right?
Yeah.
Where is this coming from? Some of our patients have had pelvic surgery, prostatectomy, stuff like that. I mean, it's like, those are kind of easy. You got a day and a
Yeah.
time.
Yeah.
The others are certainly much more difficult. And it's funny, same thing. We have not had a lot of good information or even
Hmm.
treatments. Most of what we have, I mean, let's face it, is off label.
Yeah.
And I could talk about all of those. My favorites right now. I can never say the actual compound correctly. PT 141 is probably was my favorite for the longest time.
Okay.
I know that was meant to be an ED drug, but now it's
Yeah.
used for women, and Vyleesi.
Yep.
I've prescribed Vyleesi to men who have this problem. They've done quite well with that. I know others have used other things, like your tramadol, stuff like that.
Hmm.
I
Cabergoline is one that my guys
Yeah,
use a lot.
yep,
Yeah.
that's another one. That's a good one. That one's good both for orgasm and ejaculation. I mean,
Yeah.
so that's very helpful there. So yeah, I mean, I would say that's even a more complex problem than PE, honestly,
Yeah.
because unless you have a very specific moment when
Hmm.
it happens, something that you can grasp onto that really helps you dial in on whether it's hormone,
Yeah.
the like, and they could be tough. I can tell you some of the toughest patients I had that I actually kind of got a following
Hmm.
were some MS patients were really tough.
Hmm.
That's an
Yeah.
unpredictable progressive disease that
Yeah.
that I've saw that happen in them, and that was, you talk about, here's all the tools I have. I don't know in what order we're going to use them, but I'm going to throw them all at you and let's see what
Yeah.
happens. And that's not a great way to practice medicine.
Hmm.
That's a very difficult one to really get your hands on,
Yeah.
to help these guys out. But yeah, not much of an answer, I know, when you ask a question.
Yeah. No, it's one of the toughest ones. That's why I asked you.
Yeah,
I have guys come in and they want to talk about it, and I was like, I mean, I got this one drug that we can try, and
right,
then like maybe some sex therapy.
right. No, and that's it, right? And some of that even too, and I'm glad you mentioned that about the sex therapy, because I think that's another thing that sometimes we forget about. That is,
Yeah.
just like it's getting too aroused after a while,
Hmm.
this happens long enough, it's difficult to get aroused. Like, at this
Yeah.
point, you talk about from a mental standpoint, the guys who now have tried things that you and I would never try,
Yeah.
just
Yeah.
because they're just beyond our imagination. But when you're going through that and it gets to be that difficult,
Yeah.
I mean, anything's fair game at that point.
Yeah.
So it's
Yeah.
nice we can get in front of those guys before they do anything harmful to themselves.
Absolutely. And they're partners too. I mean,
Hmm.
especially, I'm sure it is for homosexual couples as well, but I know for heterosexual couples, I will have wives say to me, well, he just doesn't find me attractive anymore. It
Right.
just doesn't feel good to him anymore. I'm like, it has nothing to do with you. Like, so I
Mm-mm.
try and get the women in with their partners just to
Hmm.
reassure them from our perspective that, ladies, this is not you. This is something that he's dealing with. And instead of feeling bad for yourself, you need to be supportive of him during this time because he doesn't have control over them.
Right. And, it's analogous to the same thing that happens to women, perimenopausal, postmenopausal. It's very, very analogous. But it's, socially, it's led to believe like, no, that just doesn't happen to guys.
Yeah,
Yeah, it does,
it does. It does.
but again,
Yeah.
we got that social stigma often plays a role as well.
Yeah. Have you had any luck with like your low T patients who have had a hard time orgasming that once you get them on good therapy, they do better or not so much?
Some,
Yeah, that's
some,
kind of been
yeah.
my experience too.
And I wish I
Yeah.
had some magic, thing that I can look up, that would tell me that these are the people who are going to benefit from that, and these are the ones that are
Yeah.
not.
Yep.
One of our colleagues, and I'll mention him. Hopefully he watches this. Christoph Jackson.
Hmm.
He had a great slide talking about this.
Okay.
About the neurologic impact of the hormones. And
Hmm.
in fact, I told him, I said, man, like, I took a picture of it. I said, but if you can send me the real slide, it'd be great.
Yeah.
I always knew there was a relationship, and he has a very strong neurology background,
Okay.
and just one of the best slides I've ever seen that really illustrates this. It gives you guidance. At the same time, it's also very ominous and scary when you realize how many things are going on at one time for this all to go right, and
Yeah.
where are your points where you can actually intervene
Hmm.
successfully and help these guys.
Yeah.
Um, they're multiple, but again, it's going to take time for us
Yeah.
to all learn all that stuff, and hopefully we get some better tools.
Yeah, and it's interesting because there's so much out there about ED, which,
Hmm.
yeah, that's great. Get your erection, but we need,
Right.
there just isn't enough on the orgasm side of it, premature or anejaculation, delayed orgasm, whatever. And there just isn't enough. And I don't get it because, yes, the erection is really important and that's great. But who wants to have sex without the climax? I mean, maybe not every time it happens or something like that, but you want to know it's possible
Right.
and you get
Well,
it sometimes.
right. No, and that's exactly. I mean, sometimes it's not the ability, but the option.
Yeah.
The guys. I mean, I can go on and on about all the guys that we talk about. We use just the prostate cancer patients, are kind of the easiest to
Hmm.
talk about. Everything from their climacteria to their ED to their,
Hmm.
and the ability they can no longer ejaculate.
Yep.
I mean, all those things, it's when you explain it to their partners, a lot of times it's really letting them know, it's like, look, maybe you guys don't have sex any longer, but the ability to just know that you could, if
Mhm.
you wanted to, if that once in a blue moon did occur, and like, you
Yep.
could do it. I mean, that's just living for some people.
Right.
It makes them feel alive, and there's nothing wrong with that.
Yeah.
But you brought up a really good point. I can honestly say I've never, in all my time of speaking and talking about it, it bears mentioning that this is something that does happen to guys, the delayed
Mm-hmm.
ejaculation, and don't trivialize it, because it's not good. I mean, it just,
Right.
we see them when they come in to see, but I'm just as guilty as anybody. I mean, we don't talk about it enough,
Yeah.
um, for
Yeah, I
sure.
can't say it's
So,
one of the questions that I ask. Are you happy about your time to orgasm? Or, I
right,
don't think
right.
I ask that really. I ask them if they have a good sex life or if they're satisfied, but I don't really ask about time to orgasm. And that could be something that maybe would open those questions.
Yeah, yeah, we're working on our marketing stuff. I mean, I guess I'm gonna have to throw this in the mix a little bit because I didn't till now, I didn't really
Yeah.
think about it very much. So,
Yeah. Yeah. I've just had, and you're right, most of my guys are post prostate cancer, but I've had a lot of them lately that are just really struggling and it's affecting their relationship because their partner thinks it's them and it's affecting,
right.
their confidence overall and everything. So it is a big deal and we don't have enough to help them.
Have you noticed something? I mean, have you seen more post-COVID where people had a lot of time to sit around alone and start thinking about things? I mean, that's makes me wonder if that's how this jumped to number three is a search,
That could be, yeah,
because we saw a lot of stuff. I mean, kind of just, I mean, really in general, all the men's health stuff. I mean, we've seen a lot of things now shift because of that. Mental health has
yeah,
really jumped up there. It where
yep,
in some age groups it didn't even show up.
wow, yeah,
Right?
right,
Yeah, it wasn't that it wasn't there.
yeah.
It's just
Well, and I
measurable
wonder
now.
too, like, so on, and you bring that up with the premature ejaculation side, we had this time frame where we were told not to touch each other. We were told to stay away, 6 feet different, like all of these things. Did that have an impact on guys spending too much time by themselves and masturbating so much that then when they're with a partner, it's so much more exciting that they're having premature ejaculation now?
Sure, no, there's that. I mean, and then sex therapists talk about this all the time. And I'm joking. The way I spin it to my patients is like, yeah, if you self-stimulate, I go, you're never going to let you down.
Yeah,
You'll go to the finish line with you.
right.
But when you got another person, your partner, I mean, that's where it can be
Yeah,
a little bit more challenging, and
yep,
you can get in your own head, right, about all
right.
of it. Right?
Yep,
So
yep.
you're right. I suppose we could parse it apart, but I guess isolation alone is going to open up all kinds of cans of worms.
Yeah. 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 And then I have some ladies who will come in with recurrent UTIs because I see women too.
Hmm.
And we'll narrow it down to their husband is having a difficult time with his erections or with achieving orgasm. And so their friction and their time having sexual activity is a lot longer than it used to be. And now she's getting irritated and getting UTIs. So now she doesn't want to have sex. And so I end up treating both of them. They
Right.
come in and see me for their own appointments. But, we get him treated with a good ED medicine and get her on some vaginal estrogen. And then we kind of can get them both back to being active and happy. So
Sure.
I do a lot with couples, not necessarily in an appointment together, but when they point out what's going on with their partner and then they'll send them to me.
It's funny when I started doing sexual dysfunction, I was doing it from the internal medicine side before I went to
Yep.
urology. And so I mean, I was taking care of their partner. I was
Hmm.
doing their annual physicals for the male and the female.
Yeah.
So I was like going, well, you know what? I got a full spectrum of the environment that we're dealing with here. And I used to think it was a lot of labor until I realized that it actually, if I had to translate, the amount of time I spent with her and him, and then how I could come to a conclusion or decision about treating them, it was actually in retrospect a lot easier.
Yeah. Yeah, it makes a big difference.
Yeah. So yeah,
Yeah.
you're smarter than me. Or I
I
just, I
just
mean,
see the women and the men. You
yeah,
specialized.
yeah, I got locked in, some time ago, and I go, well, that
Yep.
door's open now. So,
Yep. You live in the penis
uh,
world.
yep, I do. That's okay. It's all right.
Yeah. That's funny because they joke with me, I do see men and women, but you go into my office and all it is funny penis stuff everywhere. And I'm like, well, yeah, because penises are funnier than vaginas.
Yeah, I
You
mean,
can just do more silly things with them.
this is, which is true.
Yeah.
I mean, I'm not gonna. I'll keep it a family show.
Oh, that's good. Well, no, I think this was a great conversation. I think,
Yeah,
we covered a lot for both sides of premature and delayed orgasm. So I think it's good. We'll get together again and talk
yeah.
about something else. I love having you on here.
Thank you. No, like I said, I'm excited finally to get on after all this time we've been doing this. This is great.
Yeah,
And
yeah.
I used to think there was too many podcasts, but I think in our space there's not enough.
Yeah. Well, and we all have our own personalities and our way of talking and you find the person that you can listen to and enjoy. So I think it's all
Yeah.
right that there's a few of us out there.
No, absolutely,
Yeah.
absolutely. So, but again, thank you for having me. And
Yeah.
like I said, I'll circle back with you. I'm sure you just either a text message or something. I'll let you know how it's going when we launch this
Awesome.
thing, and maybe
Yeah.
we can have a sort of a catch up on how it's going. So,
Yeah, that'd be awesome. Well,
all
thank you so
right,
much for coming on and thanks everybody for listening. We'll see you
yeah,
next time on Between the Sheets.
all right. Take
Thank you for listening and spending time with me today. You can catch new episodes of Between the Sheets every Wednesday, because what better way to add some spice to your life than to have a new podcast on Hump Day? We will continue to explore common, uncommon, and taboo topics related to sexual health and wellness. Please send any comments, questions, or stories to podcastbetweenthesheets@gmail.com. That's all one word, podcastbetweenthesheets@gmail.com. Have a great day. And remember how important it is to discuss these topics with your friends, your family, and of course your partners. In fact, you can like, follow, and share this podcast so they can see it too. See you next time for more sexual health topics between the sheets.